talking in these. So if you want to take just 1 minute to breathe, that's okay. But as soon as you start talking, we will start the timer.
Hi, my name is Dina and I'm the pharmacist. Would you like to take a seat at the consultation room so we can talk things more private?
It's okay to just talk here.
Right, okay, no problem. Just before we start, I would just like to let you know that everything that we'll be discussing today will be kept private and confidential between you and me. Are you happy about that?
Yeah.
Right. Can I start off by taking your name, age, and a date of birth, please?
My name is Jasmine McNeven. I'm 30 years old.
Nice to meet you, Jasmine. Is it okay for me to call you Jasmine?
Yeah.
Right. I've got the prescription over here from a GP. It says it's ciprofloxacin 500 milligrams. Do you know why you're taking this?
I have urinary tract infection, and that's the only thing that I know.
Right. Okay. And you have been taking trimethoprim at all? Is that right? For a few days ago.
Yeah.
And how are you coping with the UTI? Do you know what a UTI is?
Not really, but yeah, I took the trimethoprim, but then I stopped after 2 days because
Right.
yeah, it didn't really work for me.
Right. So do you know the reason why the GP has changed the ciprofloxacin is because your urine culture result has come back and it says that trimethoprim is not effective to get rid of infection. That's why you're now on ciprofloxacin. And do you know how to take ciprofloxacin?
No.
Right. So ciprofloxacin is a type of antibiotic. So it works to get rid of the infection that you're having right now. You take this as directed. So 1 tablet 2 times daily for 7 days. And it's important to then swallow whole and do not chew or crush because it can affect the effectiveness of the medication. And it's also important that you sort of take the full course of medication, even though you feel that symptoms is getting better, you still need to sort of finish the course to prevent infection from coming back in the future. And also, it is important that you do not drink milk or take any indigestion remedies for heartburn over the counter, or to sort of take things having iron or zinc, so for example, multivitamins. So do not take these 3 items 2 hours before after ciprofloxacin because it can affect the effectiveness of the medication, if that makes sense to you. If you forget to take a dose, take it as soon as you remember, unless it is near the next dose. If that's the case, just skip the missed dose and never ever take 2 doses at the same time to make up for the forgotten one. Does it all make sense to you?
Yeah.
Right. It is also important that to sort of take note of some side effects that you may or may not experience. So you can feel nauseous or vomiting. If that's the case, do not panic. It's perfectly normal. Just stick to simple food, so white, rich or spicy food, and it can help by taking the antibiotic after food. That might help a bit. And then if you do experience diarrhea, just make sure that you keep yourself hydrated. Drink lots of fluid to replace the water in the body. And it is also important to then keep an eye out for a more serious type of symptoms. So if you do experience something like swelling in the mouth or the face, or abnormal skin rash, or like difficulty in breathing, it can be a sign of an allergy. If that's the case, seek medical attention straight away. Or if you do notice that the symptoms are getting worse, so the infection is getting worse, you have to have a lower back pain, or you do feel a bit feverish, that can be a sign of a kidney infection, which means the infection has come up from the urinary tract up to the kidney. So that will need medical attention straight away as well. If you do experience symptoms such as increase in breathing rate, increase in heart rate, low blood pressure, not budging rush, then this can be a sign of a sepsis. So it means that an infection in the blood. So again, can be dangerous. Seek medical attention straight away. Are you still following me? Does it all make sense to you?
Yeah, you talk about the back pain just now. I think I have some back pain.
Right. Okay. Is it just have you just experienced this just recently, or?
Yeah, recently.
Right. Do you notice any other symptoms like feverish or pain in the muscle?
Yeah, I have fever like last night, and also some soreness, and yeah, something that I really worry about is the blood in my urine.
All right. Okay. So that's something that you need to then take. Is it right? Is it something that you need to let your GP know straight away? Because I'm suspecting that the symptoms are getting worse and it can be a sign of a kidney infection, hence the blood in the urine. In the meantime, still continue to take ciprofloxacin. I will then dispense it to you today. So keep on taking it, but then get a medical attention straight away by today, if possible, because it can get serious. In the meantime, if you do feel that you can't cope with the pain, like the burning pain when you're passing urine, I can sell to you paracetamol over the counter. It's important that you don't take ibuprofen over the counter because it can interact with ciprofloxacin. But then I can sell you paracetamol alongside by dispensing ciprofloxacin today, and then what I would do is to get an urgent medical attention from the GP by today, if that makes sense to you.
Okay.
Yeah. Right. So far, are you following? Is that all right?
Yeah.
Yeah. Would you like to have some like advices on how to prevent UTI in the future?
Sure.
If that's okay for you.
Yeah.
So my best piece of advice is keep good hygiene. So always wipe from the front to the back so that you don't pass on the bacteria from the back, so from the rectum area up to the urinary tract, if that makes sense to you. And you can take, cranberry juice, although very limited evidence, but then it can work for somebody else, so it's worth trying. And I've also noticed earlier on that I've recommended you to use vaginal douche.
Yeah.
I've made a mistake over there, so you shouldn't be using vaginal douche because it can disrupt the bacterial flora, which then will then cause an ideal environment for bacterial growth. So I've made a little mistake over there. I'm sorry about that. You shouldn't be using vaginal douche while you're having UTI. So just make sure that you just wash it with plain water, and that would do. And whilst again, paracetamol for the pain, and then do not take ibuprofen for the pain as painkiller. And then drink lots of fluid to sort of flush away the bacteria from the urinary tract. I know it's not the most pleasant experience to get a UTI because of the burning pain, of the frequent need to go to the loo during the night. That's not the most pleasant experience that you have. But then it's just rest assured it will be better in a couple of days' time as long as you take the medication correctly and then seek medical attention for the possible of having a kidney infection. So rest assured, it's very, very common among women actually than men. So you're not alone in this. We are here to help. If you do need any follow-up session after that, I'm more than happy to help you. I can arrange a follow-up in 7 days' time if you need to talk or if you do have any queries. Just do not hesitate to get in touch with me if that's all right for you.
Okay.
Do you have any question at all? Do you think that's helpful? Do you have any queries that you would like to ask?
Yes, thank you. Okay. We can start.
Yes, if you start introducing yourself, then I will start the timer.
Okay. Hello, good afternoon, Miss. I'm Theodora, a pharmacist from a few days ago. How are you? I suppose you came here to continue your treatment.
Yeah.
Am I right?
Yeah.
Okay. So could I steal a few moments of your time so we can go to our counseling room and have a little chat about... Okay, so please follow me, Miss. Okay, please just make yourself comfortable. And before we start, could you please give me your prescription and your CBEU test result we have been waiting for?
Yeah, here it is.
Oh, thank you, Miss. Let me just read it. And this one. Okay, so Miss Jasmine, could you elaborate a bit about your symptoms? How have you been feeling these past couple of days since we last see each other?
It didn't really work actually.
Okay, and why do you think so?
I don't know. Just that the previous medication is not really working for me.
So itching hasn't been decreased?
Yeah.
Okay, and and about some pain while urinating?
Yeah. Just like previously.
Okay, don't worry, miss. As we see here in CBE result, that's just because your previous medication was not that effective, and that's because your bacteria were resistant to it. But with this, we have like the perfect drug for you. Okay, and before that, I have to ask you some more questions. Okay.
Yeah.
Okay, so do you have any other medical condition maybe you haven't previously mentioned?
No, just the UTI.
Okay, okay, and you haven't been taking any other drug or supplement?
No.
Okay, and one more question. I'm sorry if.
Oh yeah, I'm taking the cranberry juice and the vagina douche that you gave me last time.
Oh, okay, okay, that's good to know. And could you tell me, please, if you are maybe pregnant or breastfeeding at the moment?
No.
Okay, thank you firstly for all the information given. I'm glad that you did everything as I said to you before. And as you see, in your prescription, it's stated that you need to take ciprofloxacin. It's an antibiotic. And Dr. Byte said that you should take this drug 1 time per day. So on every 24 hours, 1 tablet. And you can take it at any time of the day. But the most important thing is you should need to take it separately from the meals that consists of dairy milk, dairy products, okay? For example, if you drink milk, that can lower the effect of this medication, and we do not want that to happen. So may I suggest, if you take this medication for 7 days at noon every day, it will be easier for you to remember, okay? And because we are eliminating bad bacteria from your urinary system, okay, we need to keep your good bacteria in your digestive system protected, okay? So I will suggest you this probiotic, and it also needs to be taken once daily, okay? And I will suggest you a type called Saccharomyces boulardii. So you can take it at the same time as you take this antibiotic, okay? So for example, at noon as well, you will take both of them, okay? And also, because we need to protect your vaginal flora, okay, I would recommend you also to use this vaginal probiotics, okay? It needs to be taken twice daily. And you can take it, for example, after douching in the morning, after douching in the evening before bed, okay? You should put it into your intimacy region, okay? And it will resorb in your system. And if you use all this as prescribed, you will be fully protected, and we will eliminate your bacteria soon. But the most important thing is that you need to take this medication for the 7 days straight, okay? Do you have any questions so far, maybe?
No.
Okay, and you mentioned cranberry juice, but to maximize the effect of your therapy, I will suggest you to start drinking, okay, bearberry tea. And bearberry herb is a well-known for eradication of urinary bacteria, and it's really good, but it's pretty strong. So I will give you just a advice on how to prepare it and use it safely, okay? So you need to take 3 to 5 grams of this leaf powder, put it in the glass, and soak it in the 150 milliliters of water and leave it for 12 hours. So basically, you prepare it in the evening for the next day. And after that, you drink the tea and drink 3 to 4 times per day for 7 days. So if you feel any discomfort, you have my card. I will give it to you. You can contact me at any time, or you can just come here and we can resolve the issue, okay?
Okay.
Do you have any questions? If
yeah.
I'm being clear?
Actually,
okay.
I'm just a bit stressed that because I have blood in my urine last night.
Okay.
And what should I do?
You don't need to worry, okay? We will fix this problem. You just need to start taking this medication, okay? And if that thing continue to happen to you, you can go to your doctor and consult with him, okay? Because your condition was not improving, but if you start this treatment like this, you will get better for sure. In any case, you can just contact your doctor, Dr. Bite, and see why is this happening, okay?
Okay.
And I have to add a few things more, okay? Just for your own benefit. Please refrain yourself from sweets, okay? If you are a sweet tooth, maybe it will be difficult for you, but you know, sugar from sweets can help bacteria grow, and we do not want that to happen, do we? Okay.
Okay.
And you just continue douching as usual, as you did before, and try to take as many showers of your intimus region as you possibly can. Do not forget to put these capsules in the evening and in the morning to protect your vaginal flora. And last but not least, please avoid having sexual intercourses. And that's because your bacteria can be transmitted while intercourse. So maybe the best thing to do is to consult your partner to do CBEU as well, just to be sure that he is not infected, okay? And after you complete this treatment for 7 days.
Thank you, Theodora, your time is up.
Okay.
Thank you so much for joining us today. So like I explained, we will...
Hello, Miss McNevan. How are you today?
Hi, great.
Is there something I can help you with?
Yeah, I'm here to collect my medications.
May I see your prescription?
Yeah, here you go.
You? I see that doctor changed your medication. Have symptoms changed in any way since last one when you came?
It didn't change much, just like previously.
Okay. According to your CBU, this one should do the job, but I have some doubts about the dosage. I think you should take 2 times 500 milligrams per day, but we should consult your doctor about that. We can call him right away if you want to check the prescription with him.
Yeah.
Okay. We are on that. Okay. So your I recommended you cranberry juice and douching last time when we spoke, but I have some doubts about that. So I think you should stop using cranberry juice and stop douching because I guess cranberry juice might won't work as well as some other types of alternative medication like bearberry tea. UIURC tea. I think I'm pronouncing it right. Because it lowers your possibility for interactions with the drug, and douching might worsen the infection, so you should stop with that. And when you start your therapy, you should always use your medicine at the same time. So if you take one at 8 o'clock in the morning, you should take it in the 8 after in the evening, always 12 hours apart. And if you forgot to use it at the time, you should take it as soon as you can, or as soon as you remember. And the next one should be 12 hours after that. I hope you're following me.
Okay. Yeah.
Please do not duplicate dosages if you forgot to take one. And it's important that you use your therapy all 7 days, even if symptoms stop. About bearberry tea, you should never take it longer than seven days, and prepare it with cold water, not with hot, because it's better taste like that, and you won't have digestive problems. You shouldn't have that. Sorry. do you have any questions so far?
No.
Okay. And I recommend you taking probiotics 2 hours after taking the medication, so you can lower your possibility for diarrhea and something like that. And you should avoid exposing yourself to the direct sunlight. Try not to go around midday or about around noon outside, and try using SPF factor or hats, sunglasses, or something like that. And yeah, you should avoid using milk and dairy products 2 hours before and 2 hours after taking the medication, so the therapy would be as it should be. Uh, now I have one a bit indiscreet question, but don't worry, everything we talk about today will stay strictly between us.
Okay.
I have to ask, do you have a partner, boyfriend, or husband?
Yeah, I do have a boyfriend.
Okay. You should avoid sexual intercourse with him during the therapy and at least 2 weeks after the therapy. And he should also go check his urine culture to be sure that he didn't catch the infection. And when you finish your therapy, you should go also and check your urine culture, so we can be sure that you eliminated the bacteria and you will be totally safe. And if any side effects occur, most probably digestive problems like stomachache or headache, consult your doctor. And if something worse happened, like swelling or heart beating, call 911 as soon as possible. And I think that would be everything. And do you have any questions or something that concerns you?
Yeah, you mentioned about back pain, and I actually have some back pain recently.
Back pain.
And what should I do?
Well, you should first of all consult your doctor, because it might be infection go up to your kidneys, so you can check, do some other tests, check that with your doctor as soon as you can.
Okay.
That's my recommendation.
Mm-hmm.
Anything else that I may help you with?
Yeah, just would like to know more about the CBEU, and also like why am I given a medication and then a test and then another medication? Can you explain about that?
Yeah, of course. Well, first the medication you were recommended was trimethoprim, yeah?
Yeah.
And CBEU showed that the bacteria that caused you the problem was resistant to it. So it means that the trimethoprim doesn't work on this bacteria. Concretely, I hope you understand me. So ciprofloxacin that you gave the second time you came to doctor should be efficient. So because it would do the job to that bacteria, it would kill it or eliminate it. Was I clear enough?
Okay. Yeah, it's quite clear.
Thank you. Anything else?
Yeah, I also have like blood in my urine last night. What do you think it is like, and what should I do?
It could be caused by the infection. It's not something inordinary, so don't worry. It will go away with the therapy. It shouldn't be problems with that.
Okay.
Anything else?
Not really. Nothing. Just that.
Okay. I hope you will be okay soon.
Okay. Thank you.
Thank you.
Thank you, Strinia. Actually, your time was just running out, so it was perfect. Hey, Aisha. I hope I'm pronouncing your name right. If not, I'm sorry. Aisha. Okay, great. So thank you so much for joining us today. I will start the timer when you start the counseling session, so you can start anytime you want. and Oslem will be your patient today. So if you want, you can pin her. So you press the 3 dots and you pin her so you can always see her. Do you have any questions right now?
No, not really.
Okay, then as soon as you're ready to start, you can start.
Welcome again, Mrs. McNiven. How are you?
Thank you.
Let me see your prescription. And I also need your personal information to process your medicine to the system. Can I get your ID?
Yeah, of course. It's here.
Yeah, thanks. When I take your information from the system, your alcohol, cigarette use, or allergy to anything doesn't appear. Has there been any change in this data?
No, it hasn't.
Okay. Are there any other medication you use?
No.
Okay, I have to ask a few more questions to be able to advise you properly. Are you planning to get pregnant soon?
No, I do not, but I have a partner. I have a boyfriend.
Okay. Have any problems been detected in your heart rate or ECG result by this time?
Actually, I started urinating blood last night, and it's only difference I have had.
Okay. Did you experience any low magnesium or potassium level in your last blood test?
I do not know about that.
Okay. Do you have any renal or hepatic problem?
No, from what I know, I do not.
Okay. After the CBU result, your doctor has changed your medication because you're resistant to trimethoprim. He decided to use ciprofloxacin for your urinary tract infection. When I checked the dosage and indications, I did not encounter any problem. Since ciprofloxacin is selected based on your CBU result, a much more accurate treatment will be applied. You can safely use this antibiotic. So as I said, ciprofloxacin is used to treat or prevent the bacterial infection. Your medicine has been prescribed to be 2 tablets per day. Take it at the same time of the day with the interval 12 hours. For example, if you take 1 tablet at 8 a.m., take the other one at 8 p.m. You have to use this medicine for 7 days. If you feel good, continue your treatment for 7 days. Do not use longer than you have been told. A second infection may happen. So you should take this drug with a full glass of water. Swallow whole and do not chew or break or crush. Do not take this drug along with dairy products like milk, yogurt, or calcium reducers. If you need to use antacid and other products contain magnesium, calcium, aluminum, iron, or zinc, take this drug 2 hours before or 6 hours after. So if you missed a dose, take a missed dose as soon as you think about it. If it's less than 6 hours until the next dose, skip the missed dose and go back to the normal time. Do not take 2 doses at the same time or extra doses. Store this drug at the room temperature in a dry place. Do not store in a bathroom. So if you have any signs of high or low blood sugar, you should tell your doctor. And if you have any signs of nervous system problems like anxiety, feeling confused or agitated, you should tell your doctor too. You may get sunburn more easily when you're using this drug, so you should avoid sun and you should use sunscreen. And diarrhea is the most common side effect with antibiotics. Call your doctor right away if you have a stomach pain, cramps, or very loose watery blood stool. Check with your doctor before treating diarrhea. So I have a few suggestions for you to prevent the infection from recurring. You should drink plenty of liquids, especially water. Drinking water helps dilute your urine and ensure that you will urinate more frequently. You should wipe your genitals from front to back. So empty your bladder soon after your intercourse. Also drink a full glass of water to help flush bacteria. You should avoid potentially irritating feminine products. Maybe you can consider change your birth control methods. Diaphragms or unlubricated spermicide treated condoms can all contribute to bacterial growth. You should avoid drinks that may irritate your bladder, like you should avoid coffee, alcohol, and soft drinks containing citrus juice or caffeine. You can use a heating pad to your abdomen to minimize bladder pressure or discomfort. You should wear breathable underwear and change hot of CB2 workout clothes and wet swimsuits immediately. So I have a few suggestions for you. Stop using your vaginal touch firstly, and I strongly suggest you to drink cranberry juice at least 5 milliliters per day, or I can suggest you capsule form of cranberry. Which one would you prefer?
Actually, last time you gave me cranberry juice,
yeah,
and I don't see any difference. Actually, I don't think it helps.
Actually, cranberry juice effects are not scientifically proven, but there is no harm. You should drink lots of liquids, and you can drink cranberry juice too. It can help, but if you want to more acceptable, I suggest the capsules maybe.
Okay, thank you.
Okay, I give you a cranberry complex 250 milligrams, so you should take this 3 times a day. So I will have a request from you. Could you tell me again how to use the medicine for the last time?
If I forget a dose, I think I should take it immediately when I remember it. And it's at the same time, and I think it was 2 pills, right?
Yes, it's 2 pills and 12 hours interval.
Yeah, and with a glass of water.
Yes. Okay. Perfect. And if you want to read more, I can also provide a document for you containing the information about the drug that the patient should know. Do you want? Yeah, okay. Okay, then I will send you as an email. Is it okay?
Yes, please.
Okay. Get well soon, Mrs. McNevin. Have a good day.
Thank you. You too.
Thank you. Hi, Christina.
Hello. Can you hear me? Can you see me? Okay.
I can see you now and I can hear you now. Welcome.
Thank you. Thank you. Good to see you.
So when you're ready to start, you can start your session and I will start the timer. You have 8 minutes. If you run out of time, I will interrupt you and tell you that your time is up. And if you feel like you have already finished, then you can just tell the patient, okay, thank you, goodbye, and I will know that you have finished. So you can start anytime you want now. Do you have any questions before you want to start?
Yes, I have a question because we already have a script. Does that mean that I'm at the point of explaining the therapy, or I'm starting from the beginning with introduction?
You're starting, so it's basically like you're in the pharmacy, so you're starting with, hello, how are you doing? And then things will go from there.
Yeah. That's the thing I'm asking. Thank you very much. I can start. It's all right.
Sure. Whenever you're ready to start, I will start the timer.
Where's the patient? I cannot see her.
I am the patient.
I forgot to mention that. So Aslam is your patient and you can actually pin her so you can always see her.
Okay, I don't do that. I'm sorry.
You can click the 3 dots on her, I guess, and then you can click pin. If it doesn't work, Osman will be the only one talking, so she should appear on your screen. Where's the candidate? I don't see her anymore. I think she left.
Yes, she left.
Okay, great.
We are done.
We'll just wait for her to reconnect.
He was on time.
I think she's coming back.
Okay, can you hear me now? I don't know why this happened. It's
worries.
Not the internet, something with my software probably.
No problem. We can hear you now. We can see you now. So don't worry about that. These kinds of things can happen.
Start.
Okay. If you're ready to start, you can just start talking and I will start the timer.
All right. Hello, Mrs. Jasmine. How are you doing? My name is Christina, your local pharmacist. How can I help you for today?
Hi, I'm here to collect my medications.
All right. How was the therapy from last time? How are you feeling now?
I can say I feel really good about it because I don't think it released any pain.
So is it causing pain or not? How is the problem? Just so you know, everything we talk between us is only going to stay between us. So you can tell me every little detail that you think will help me. So be free. I'm here to help, and I think it will be beneficial that you feel comfortable with me. And we know each other, so you are our favorite patient.
Thank you.
A regular. So how are you feeling? Is the pain consisting? Do you have troubles while urinating? Maybe do you feel maybe some certain pains in certain areas, or maybe did you do other tests in between this time that we didn't see each other?
Yeah, actually the pain is still there, but if you ask about the difference, I had diarrhea after I used my medication, and I was urinating blood last night, and it really stressed me. And I have to say that the doctor gave my medication before the CBEU results came, so I don't feel really comfortable about it. And the only left thing must be my back pain. I'm starting to have back pain, so I don't know why.
Is it the lower back or the medium of the back?
It's the lower back.
It's the lower back. All right. From everything that I heard from you, I can conclude that the symptoms indicate that it would be a kidney infection, and those newer symptoms would lead me to tell you to consult with your doctor again, because it may take a change in your therapy. Maybe he will, or she, actually Dr. Byte, might increase your dosage of the medication. So I would recommend that first, because blood is not something that is usual, and it's a new symptom. So it may change the therapy, or the therapy, the medication also, and I can consult with you for the new medication again. I'm sorry to hear that you had to change to the medication and you feel pain and also have diarrhea. Did you maybe start with probiotics when you started antibiotics? Because it is really important. From what you said, I can conclude that you probably have problems with your microflora in your digestive system, because the antibiotics might do that to your digestive system. So I can recommend you probiotics to be taken 2 hours after your antibiotic. And also for this medication, I can recommend you to avoid dairy products. So milk, cheese, yogurt, also avoid direct sunlight. If you are a driver, if you drive a car or maybe use heavy machinery or any kind of machine that may be kind of difficult to operate, I would recommend that you are cautious, because this new medication can have some neurological symptoms that may be kind of risky to operate these vehicles. So be cautious while driving. Also, I would recommend you do, if you have a partner, a sexual partner, he or she can also get tested, because even when you get cured from the infection, they can transmit it back to you. So I would recommend that they get tested, and maybe even if they don't have symptoms, they can be carriers for that kind of infection. What can I also recommend you? Oh yeah, I told you last time we saw each other that to use douches. I consulted with a couple of my colleagues, doctors, specialists in gynecology, and they said that they wouldn't recommend using douching. That is not beneficial for urinary infections, and it's not beneficial at all. So you can stop using that. Also, I would recommend for the cranberry juice to use it after the infection for prevention of reoccurring infections. Also, when you start your antibiotic, make sure you're taking it during the whole period of treatment. So every day for the whole 7 days, one tablet. Make sure you're not chewing it, swallow it whole. Make sure you're hydrated all the time, because for this particular, not only medication, but also for this problem you have, you will need to be hydrated. So for the recommended 4 glasses of water, or if you're feeling even thirstier, go ahead, drink a lot more. What if you want, I can recommend you some other maybe supplements to use, such as D-mannose, which is good for UTIs. You can use 2 or 3 grams per day of D-mannose, and it would be beneficial for these kinds of infections. Also, if you're using any kinds of supplements, I would recommend you to avoid them for this period, especially if they contain calcium, magnesium, aluminum, iron. If you need to use antacids, try not to use you can use H2 blockers, but not those that contain such minerals that I said. If you're not sure, you can always ask me for any kind of medication that you're using. If you're currently having any problems besides these urinary infections, or maybe if you're having some cardiovascular diseases, or use medication for that. If you have maybe epilepsy or certain other diseases, you can tell me, please, so we can see if maybe the doctor is not aware. Please do tell me, and I can consult with the doctor, or you can tell him next time, or call him, please. So we're here for all the information, so you can feel you can get the best possible therapy. If you experience any pain in your tendons, as well, especially in the Achilles tendons, it may be a side effect of the medication. So you can stop with the medication and consult with your doctor about it, or even after the medication, 1 or 2 weeks after the medication, you can experience such pains. Just so you know, it may be a kind of a side effect that occurs later after the therapy. So you can consult me, other pharmacists as well, my colleagues, the doctor, just so you're aware. It's not that common, but I just wanted you to know, especially if you already have any problems with your tendons.
Thank you, Christina. Your time is up.
Thank you.
I hope you had some fun today. And like I explained, we will announce the results within 2 days. That's all for you today. So you can leave the session, and I hope you enjoy the rest of your day.
Thank you. Thank you all for this amazing competition, actually, and event. It was really enjoyable. Have a nice day.
Bye-bye.
Bye.